Hello, my name is Deborah Thomas, and I am a nurse consultant for the DC Nurses Association. Today, we're going to talk about Assignment Despite Objection.
You'll also hear some of your GW coworkers here. We're nurses from various units. We think this information is very important and will help us start utilizing our union benefits as well as getting a better understanding of the conditions and needs on each unit.
First thing we're going to do is define assignment despite objection. It's actually a process to protect nurses when receiving an assignment that may pose a threat to licensure. This is a part of Board of Nursing practice to protect nursing licensure in case of legal jeopardy. The form lists criteria created by the association in conjunction with the DC Board of Nursing to ascertain risk to practice, environmental safety factors, and other variables that can negatively deter the delivery of safe therapeutic care. It determines factors which negatively impact the practice, including staffing, adequate safety standards, appropriate equipment, and administrative support. It is legally binding and admissible in court and is protected activity under federal labor laws. So assignment despite objection is a binding legal process. It is unlawful for an employee to retaliate or discipline an RN for filing an ADO. This form is used to document circumstances in which the RN identifies unsafe factors in the environment. When conditions are unsafe, the Board of Nursing requires this notification. You have a choice to not accept the assignment, which may result in termination. The process at this time will be used for data collection. Once a contract is negotiated, we will develop a process to analyze and review to promote safe practice. The forms will be available online for GW nurses only. This is a specific process for nurses from GW because we don't have contract at this time. When a contract is negotiated, we will then have a process in place for enforcement. For now, though, it is for data collection to assess conditions of work. Eventually, they will be used to promote improved changes. This process is being introduced initially to ascertain conditions of work and to educate our membership about their legal responsibility. This process is not new. It is inherent in your professional responsibility to understand your legal liability. Assignment despite objection is your tool to help protect your practice. Let's talk about the regulatory requirements for this process. The purpose of this documentation is to provide data on conditions which may be unsafe for your patients. This is your professional judgment that these very conditions could put your licensure in jeopardy. These are the regulatory agencies that require certain conditions exist to assure safe care delivery. DC Municipal Regulations for Registered Nurses, Scope of Practice, as is described in the DC Nurse Practice Act, and DC Municipal Regulations for Hospitals. And this is what George Washington University has to do to make sure there is appropriate nursing staff. The DC Municipal Regulation for Registered Nurses 5414 Scope of Practice describes the role of professional nurses and the scope of practice as is set forth in the DC Nurses Practice Act. It describes roles and responsibilities that have legal and moral authority. So when you look at your ADO form, you can turn over on the back and it gives you a concise understanding of these regulations. The DC Municipal Regulations for Hospitals describes responsibilities of hospitals to provide safe environment of care to include safe nurse-to-patient ratios, appropriate assisted personnel, and safe equipment.
Here are some of the situations in which you should fill out an ADO form. If you're given an assignment for which you did not receive adequate training or for which you do not have appropriate experience. If you weren't given an appropriate orientation to a unit, role, or skill prior to being assigned to those duties. If you were given an assignment outside of your job description. Your safety. Fill out an ADO if you have an assignment that threatens your health or safety or puts your license at risk. If your unit is short-staffed for patient volume or acuity, or if your assignment is so heavy that you're unable to deliver adequate patient care, fill out an ADO. Filling out an ADO legally documents the unsafe conditions.
You may also fill out an ADO if work conditions pose a threat to your patients, yourself, or your license. If you are short-staffed for patient volume or acuity, if you're transferred or admitted a new patient without adequate staff, if you have inadequate or inaccessible medical supplies or medications, if necessary equipment is unavailable, malfunctioning, or inadequately functioning, and if your unit is not staffed with appropriate paraprofessionals such as techs, unit secretaries, EVS, transport, or any other assistive personnel that you may need.
What are the determinants of safe care? Appropriate staffing addresses ratios of nurses to patients and needs to address volume and acuity. Paraprofessionals like PCTs, nursing assistants, EMTs, PT, OT, and respiratory therapy. All of these co-workers play a vital role in providing safe, compassionate care to our patients. Conditions of work addresses administrative support for the delivery of expert care to our patients. We know when any of these vital roles are missing or short, nursing has to pick up the slack, affecting safe care we can provide.
When reporting in institutions, our ADO reports, the most important part I feel are the nurse comments, because we want administration to know exactly what's going on. And some examples I have are from our DCNA facilities, all of our facilities. Good example is infant on high CPAP settings in withdrawal, placed on 3-to-1 nursing assignment, and unable to do appropriate assessment and discharge planning. When one of the patients was ready to push in labor and delivery, a nurse's assignment had to be split so that the pushing patient could be 1-to-1 per A1 standards. There was no other nurse to watch the other patient, and as charge nurse, I had to act as primary nurse for this patient. Charge RN had to take patients, needed to pair 2 ventilators with third patient, no EVS personnel assigned to the unit, multiple rooms not cleaned after bedside procedure, trash cans overflowing. I was precepting new grad with 7 patients while my co-worker was in procedure.
ADO forms can be found on our website, gwuhnurses.com, as well as on DCNA's homepage, dcna.org. Contact us if you have any questions, concerns, or would like to get more involved. We're always available in person and on any of these platforms.